Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look at the autopsy and the techniques which are used. This is very important. So, autopsy techniques. So, to begin with, first is the Virchow's technique. So, what is meant by the Virchow's technique is when the organs are removed one by one from the body and need to be examined. So, Virchow, you have a O here, so it is one by one. So, one by one. Virchow's technique is when it is moved one by one from the body and to be examined. Here the cranial cavity is opened first and then the spinal cord followed by thoracic, cervical and the abdominal organs. So Virchow was nothing but one by one. Next we move on to the Ghon's. So what is meant by the Ghon's technique? Ghon's technique is basically when you move it is by N block. N block is basically where there is the thoracic, the cervical and the pelvic and the abdominal organs are removed as organ blocks. Okay, so this is nothing but the Ghon's. So Ghon's technique is where there is the N block removal is seen. Where a Virchow is one by one, organs are removed one by one. In Ghon's it is N block. Next is the Rokitansky technique. The Rokitansky technique. So the Rokitansky technique is where the characteristic by the in situ dissection in part combined with the N block. So there is in situ plus the N block is nothing but the Rokitansky. In situ plus that of the N block. This is nothing but the Rokitansky. So here there is a removal like it's similar to that of the Ghon's technique, and the dissection it begins at the neck and slowly it works its way down the body and the organ is removed as N block. A cut is first made in the larynx to separate the esophagus from the pharynx, and then the larynx and the trachea are pulled downward and using a scalpel the chest organs. So that is how the procedure moves on. Next we look at the Lettius technique. So what is meant by the Lettius technique? So Lettius technique is where the thoracic, cervical, abdominal and pelvic are removed en masse. So Ghon's was N block. Ghon block. Now this Lettius is mass. Lettius is mass. So they are removed en masse, meaning as a one big organ block. So that it allows the body to be made available for the examination in less than 30 minutes, as the process is removing the organs is much quicker. So Lettius, as you can see, it is a very quick process and it is where the mass is removed en masse. En masse removal is seen. To learn and grow daily like this, please do subscribe.